first thing we'll be doing is we'll be getting a lab specimen, we'll be hanging fluids, and then we'll be starting IV and giving the fluids to the patient. So the first thing we want to do is gather our equipment. So we will have our blood tube, our needle, and our vacutainer. Have those there. So then we'll enter the patient's room, knock, knock, knock. My name's Brian, I'll be your nurse today. You perform hand hygiene, tell the patient what we're doing. So we'll be collecting a lab specimen, and then we'll have the patient identify who they are. So Betty Johnson, 6'9", 60". So that is correct with our computer system. So when we'll put them in a low Fowler's position. So the first thing that we'll be doing is finding the vein that we want to use first. So we'll tie our tourniquet first. So when finding a vein, whichever one's bouncy, so we'll go with this vein here. We'll identify the vein. Pop the tourniquet while we get everything prepared and cleaning. So now I'll put the gloves on. Too small. Alright, so we'll clean the site.
But I don't know what it was.
Clean the site here. So then we'll throw this away. Now we'll prepare our blood draw set.
That's why I didn't go on. I was like, what the heck? I noticed you didn't
We'll have our blood tube by the side. So now we'll tie the tourniquet again.
You know what? You figured it out.
It says application about allergies, medications,
Alright. So now we'll obtain our specimen. When drawing blood, you always want to have the bevel up. So we have the bevel up, the tube here. So we'll feel for the vein. Kind of pull back so the skin's tight. Until the patient's are going to feel a little pinch. Little pinch. So now we'll check if we're in the vein. Which we are in the vein, so we're collecting specimen. We'll pop the tourniquet. There we go. And then we would usually have gauze pads, but we don't have any gauze pads, so I'm just going to use this alcohol wipe. But when pulling out the needle, we'll put the gauze on top to control the bleeding. Cool, and then we'll safety the needle. And if your blood tube has some powder or solution at the bottom, you want to invert it 5 times gently. Okay, so there's our blood tube. And we will label the tube with the patient's identification. Alrighty. So then we'll send that to the lab. So now we're going to do IVs and hanging fluids. So the first thing before even setting up or doing it, you want to get your equipment, which I have all my equipment here. My fluid, my tubing, and then I have my IV kit, my J-loop. This would usually be sterile, but we do not have one, so we're going to have like this sterile, our flush. And then we have our IV needles and our cap. We'll have that there. Again, we'll enter the patient's room, knock, knock, knock. My name's Brian. We'll be doing IV and hanging fluids. Do you have any allergies? They say no. We'll have them identify their name and date of birth. Betty Johnson, 6'9", 60", which is correct. So by the first thing that we're going to do is we're going to prepare our fluids. So we'll open our bag here. See if we can find the opening. Okay. So hold that. Get our IV tubing. we always want to make sure our roller clamp is clamped. So the first thing we'll be doing is we'll be popping off this blue top,
And then you'll want to do it like
making sure we do not touch this because this is sterile, and then we'll pop off the cap of our tubing. Also not touching that because that is sterile as well. Push and twist.
like when we turn it, you know.
Cool. Hang it over.
Well, not with this. So this
We'll
one
hang it
so this one goes on the
on
main
the
part
IV
where the
pole.
needle's actually inserted. So it goes right there.
Squeezing some fluid into the container. About half
Yeah, I
full.
think it goes, yeah.
There we go.
And then you take the rest
So
of
here's where we will
So we'll make sure to have like the tape.
unclamp, making sure we get all the fluid, all the air bubbles out.
Do we have regular tape in our bags?
Do not want any bubbles.
Okay, that works.
Okay. All the bubbles are out. We will just hang this on because it is sterile because the cap is still on. So then we'll just hang it up here. Okay, cool. So now we're going to tell the patient that we'll be, again, doing an IV as well. So the first thing that we want to do is tie the tourniquet on. There goes our flush. And then we're going to be finding our vein. So this is our first, so we'll be using this vein here. So we did find it. So again, we'll pop the tourniquet off. Open our IV kit because this has our cleaning solution and it has our gloves in there. And so our little cleaning, small. Our gloves. And here is our IV dressing. Alrighty. So the first thing I'm going to do is I'm going to put my gloves on. These are not sterile gloves. Alright. So the first thing we do is we're going to get everything prepared. So usually this J-loop would be in a sterile package, but we do not have one, so we're going to act like it's sterile.
So,
And we'll add our sterile cap on.
is it gonna fit into?
It may or may
So
not.
try not to touch this top part because that top
It
part is still
probably
considered
won't.
sterile.
Yeah.
And so as well as in here.
I don't know if it will.
Yeah, because it doesn't have those.
Sterile.
The little notch
Tie that
Yeah.
on together.
so you could just
So that is on.
pretend,
Okay.
We're going to touch our flush now.
close the door, put it in.
We want to flush our J-loop so there's no air in it.
Yeah.
So flush. Well, it's flushed. And now we'll clamp it. We'll clamp it and leaving the cap on because it's still sterile if we leave the cap on. And leaving the flush on will also help it keep it sterile. We have our dressing here. We have our needles. We have a cleaning kit. And now we'll be cleaning the IV site. Popping these two sides together. And then we'll clean it. It's clean. We're gonna let that dry and we would be throwing this away as well. So here we're gonna tie our tourniquet. Okay. We're gonna let that dry. Okay. It's ready. It is dry. So now we'll get our IV out. Alright. Again, throwing that away. Our little trash pile. Pop our needle off. The cap. And then we'll do bevel up. Always bevel up. And this is a safety needle. So now we'll tell the patient again that they'll be feeling a pinch. Alright. So they'll feel a pinch. In 3, 2, 1.
Try not to cover this
So we have a flash.
before you would.
We want to advance just a little bit more.
Put it kind of like
And
bullseye
advance
this
our catheter.
in the center.
Okay, so just like that,
Mhm.
and then
Yeah.
just.
And a
So our
lot of times
catheter is
people
in.
don't put that separate.
I'm going to get this prepared because
They want you to put that in first
blood will
and
go
second.
everywhere.
Okay. And what do I tape down?
This.
I'm gonna retract my
Okay.
needle, trying to hold pressure,
Okay.
popping the tourniquet,
Okay, gotcha. Thank you.
retract my needle. Oh, it's blowing. Catching our needle, there we go. Our J loop's on. We're gonna unclamp our J loop. Make sure that we're in, so we're gonna pull back a little bit. We are in. I'm gonna flush. Okay. It's flushed. Moving this once again.
You're over there by, the library.
Clamp that as well as we could.
Gather my equipment.
It's clamped.
I know, yeah.
We're gonna grab another alcohol pad. Okay.
And then
Open it, we're just gonna clean under the IV site. Okay. Hold it onto the IV site because we do not want to lose it.
I know, and then you're basically
open our
asking the patient if they have any
Tegaderm. We will place our Tegaderm on.
So this one too. Yeah, just in case, because like, what if we have an allergy to certain type of blood?
Doing this off.
So
Here.
I would ask them if they have any allergies. Hygiene.
And then with any dressing, you want a date and time when you did it. Okay, I'm just gonna put this
And
part
then get your good ones together.
here.
And then put it back on. Well then,
We'll put it there, and then we'll date and time when we did it. So I would put my initials and the time.
yeah.
And so that is our IV site there.
And then
So now we want to attach our fluids
pressure for 2 to 2 minutes.
here.
Once we're done, I'll put a band-aid over it.
Fluid. So acting like this was such something, we just want to be safe once again.
And remember, say you're gonna put your needle and everything in your
Acting like I had a clean alcohol
Put that in
swab,
the biohazard bag.
and we would clean the tip there. Make sure it doesn't touch anything. Pop this cap off.
I was gonna say bevel.
Attach.
Because I mean, I'm doing it in the video, but she probably can't see. Yeah, she can't see it, but just anything
And
she
then we
can't
want to open the
see,
clamp to
I'll
make
say, but,
sure
like,
we
she's
have
gonna
that it
see
is
the
dripping.
angle.
So I'm gonna unclamp the J loop now.
It's so long. It's like, what if I mess up like halfway through? Yeah.
And it is dripping. Cool.
Keep it
So now the biggest thing we want to do is clean up, and then we'll be monitoring the IV site and the infusion every 2 hours. And we'll be putting the patient back in their comfortable position.
Yeah, are you ready? You got